Hello, my name is Kyra Hilmer. This is my career PowerPoint on nurse anesthesiology. This is my long-term educational and career goal. As I take you through this brief overview, I hope you'll find this career just as fascinating as I believe it to be. To start out, the job outlook is a positive aspect of this career. Employment is predicted to increase by 31% from the years 2014 to the year 2024. This is significantly higher than the projected increase for a typical registered nurse or RN degree, which is expected to increase by 16%. Another important aspect to look at in terms of the relation between being an anesthetist and the medical field is that the medical field is continually growing with new technological advances and increased need for end-of-life care. This ensures that a lack of medical-related jobs is not forthcoming. This brings a sense of security to those working in the medical and health-related fields. Also, when it comes to the field of anesthesiology, many organizations are utilizing the CRNAs in place of anesthesiologists. This is due to availability and costs, especially in the rural areas, bringing further increased demand for being a CRNA. As we take a look at the job duties of being a nurse anesthetist, we realize they do a lot more than just administer anesthesia and medications. The actual job consists of full medical care of a patient, starting from preoperative care such as physical exams and observing patients, to creating and contributing to the patient's care plans and performing or ordering diagnostic tests. In the actual operating room, the CRNA is responsible for operating medical equipment and the actual administration of anesthesia. During the time that the nurse anesthetist must critically analyze the patient's condition and evaluate the patient's response to medications and treatments. Postoperative care is vital for a CRNA, as they may be responsible for counseling and teaching patients and their families on how to stay healthy and manage their illnesses or injuries. If you are a long-term CRNA, you may also be responsible for conducting further research on how to advance your medical field. If you look into the typical work environment of a nurse anesthetist, you may find that the typical workplace is a hospital operating room. This hospital job may have a more erratic schedule, including long hours such as 12-hour shifts, or an on-call schedule, which means that you may have the weekend off, but you need to have your cell phone on hand and be within a certain time frame of getting to the hospital if needed. Other environments may include dental offices, plastic surgery centers, or outpatient surgical facilities. These environments may have a more standard schedule, for example, an 8 to 4 where you can be home with your family at night and there is no on-call. You are just on a set schedule. Another important aspect of the working environment is that you can really get a job as a certified anesthesiast anywhere you go. That means you can travel across the United States or even go abroad, and you will be able to find a location, whether it's a hospital or a dentist or a tent for the military, that needs an anesthesiologist of some variety. For many people, the salary of their future careers is a huge aspect on which career they choose. CRNAs are the highest paid registered nurses in their entire field. Salaries are adjusted based upon work setting and location of the employment. States may have pay adjustments that coincide with cost of living. For example, if you live out in New York or California, where the cost of living is higher, it's likely that you will be paid more and the average salary of a CRNA will be higher there, versus rural settings, which often pay less than those large metropolitan areas. But overall, the CRNA is very well paid when it comes to their work. In 2016, it was stated that the average pay for a CRNA ranged from $105,000 to $240,000, with an average of almost $160,000 a year. After looking at the pay scale of what it means to be a certified nursing anesthesiologist, you're probably thinking, how can I become this anesthesiast? The educational requirements are pretty straightforward. First, since CRNAs are considered advanced practice registered nurses, it makes sense that you must have an RN degree with licensure in at least one state, and you also have to possess a BSN degree, so it has to be a 4-year RN degree or a different appropriate bachelor's degree that coincides with that. After you achieve that RN degree, you have to get into an accredited nurse anesthesia education program. This typically takes 2 to 4 years, depending on the intensity of the program. And some schools may require at least 1 year minimum of acute care experience, such as intensive care or ER experience, before you can actually be admitted into the anesthesia educational program. From here, you have to do active clinical training. Oftentimes, this is part of the actual education program. Other times, you have to go separate before you can actually get your certification. And last but not least, like many professional degrees or doctorate type degrees, you must also pass a national board certification test before beginning practice. So all in all, it averages out to about 7 years of college education, but it is a lot of hands-on work through that clinical training, and you kind of get to take a break in the middle of it to get a feel for what it means to be a registered nurse and decide if moving to be a nurse anesthesiast is exactly what you want to do. Now I'm going to take you through just a few fun facts about being a nurse anesthetist. If you go back to the Job Outlook page, you'll recall that we talked about how CRNAs are often more common in rural hospitals and rural areas in order to save time and money from the hospitals there rather than hiring an actual anesthesiologist. Well, an interesting thing is that the CRNAs are actually primary anesthesia providers in rural America, and in some states they may be the sole provider of anesthesia in rural hospitals, meaning that they don't have an actual anesthesiologist looking over their shoulder or supporting them along the way. They are totally independent. Another interesting fact is that nurse anesthetists were actually the first nurses to receive direct reimbursement rights. This means that you can go back to school, and oftentimes your current workplace, if you agree to stay with them, will actually reimburse your education, so you can continue to learn while working or take a short break and promise to return and further your education in that way without the financial deprivation that going to school may cause, especially in today's day and age where the cost of going back for your master's degree can be fairly hefty.